secret signals your pet is sending and what they really mean. Hi everyone, I'm DrVet, and today I'm about to reveal something slightly terrifying. Your pet has been sending you secret signals. Signals that something inside their body isn't right. Signals most owners miss. Signals that if you learn to read them can save you money, worry, and sometimes it can save your pet's life. So grab a coffee or tea or whatever you drink while someone traumatizes you with animal facts. Because today we are decoding your pet's hidden language. So let's begin. So why pets hide pain? You might think if my dog or cat was in pain, surely they would let me know. No, they would not. Pets are dramatic about the bath time, but uncover MI6 agents when they are actually sick. Dogs and cats instinctively hide weakness. It's survival behavior. In the wild, weakness equals vulnerability. And so instead of screaming, "Help human, my kidney is crying," they send tiny subtle signs. And it is your job as an owner to catch those signals early. Today I'll show you what those signals look like, how to tell which ones matter, when to call the vet, and when you should stop Googling because you're scaring yourself. First of all, behavioral changes. Suddenly cleaning less on sudden distance. If your pet goes from never leaves your side to "I now live under the sofa," that's a signal. If your normal independent cat suddenly become a furry Velcro strap, that's another signal. Behavioral changes are often the first red flags. What it can mean? It can mean pain, anxiety, it can mean hormonal issues, internal discomfort, or early neurological changes. So when to worry? If the changes last longer than 24 to 48 hours. When we've got reduced playtime, if your dog stops bringing you toys, or if your cat retired from Olympic level zoomies, that's not being moody, that means something hurts. Change in sleeping habits, sleeping more than usual, or sleeping less than usual if they suddenly choose a new sleeping spot. Pets often move to cooler or darker place when unwell. Another signal category is movement changes. You don't need to be a vet to notice subtle mobility issue. Slowing down on walks. If the dog who usually drags you like a sled suddenly walks behind you, that's not personality change, it's pain. Hesitating with stairs or jumping. Cats rarely tell you that they are hurting, but when they start hesitating to jump onto the sofa or windowsill, that's a big red flag for arthritis or potentially injury. Another thing, stiffness after resting. If they get up like 80-year-old after a nap but loosen up after moving, classic early arthritis. This is not just aging. Aging should be comfortable. Pain is treatable. Discomfort is treatable. Another thing you should be aware of is eating and drinking changes. Well, not eating is obvious. Eating slower is the subtle early sign of pain, nausea, dental problems, or throat issue. Asking for food at weird times, for example. Sometimes if pets feeling nauseous, they eat grass, beg for food at night, or skip breakfast. Patterns matter. Drinking more or less. Increasing drinking can mean kidney issue, diabetes, hormonal imbalance, infection perhaps, pain or stress. Decreasing drinking is equally worrying, often nausea or fever. If your pet drinks more than usual for 48 hours, please call your vet. So another thing, body language clues. Squinting, blinking or head tilting. Weird eye behavior. Think pain, headache, eye pressure issues. Head tilt, that's not cute. That's vestibular syndrome, ear issue or something neurological. Lip licking, yawning or nose licking when not tired or hungry. Those are stress and pain signals, especially seen in dogs. Cats hide this even better. A hunched posture or praying position. A dog stretching forward with the bum in the air, well, it looks cute. If they do it repeatedly when not playing, this is a massive red flag for abdominal pain or pancreatitis. Cats will loaf tightly when uncomfortable. The tighten the loaf, the more worried you should be. Tail signals. For dogs, tail low, uncertainty or discomfort. Tail tucked, fear or pain. Tail rigid, tension, discomfort. Tail wagging but stiff, not happy. This one surprises people. Stiff wagging means anxiety or uncertainty, not a joy. Cats, tail flicking, irritation, nausea or pain. Tail tucked, fear or discomfort. Puff tail, stress, fear, or pain. Grooming changes. Overgrooming signals pain, skin disease, stress, urinary tract discomfort, in cats particularly. Undergrooming in cats is a huge red flag. Cats who stop grooming are almost always unwell. Another signal is strange vocalization. For dogs, sudden whining, grunting when lying down, yelping when touched, barking at nothing, but not the normal intruder leaf blowing across the street bark. Those can mean pain or anxiety. For cats, cats are the drama-free species until something goes very wrong. Increased meowing at night, low growling, sudden silence in normal talkative cat, crying in a litter tray. Never ignore a cat making new noise. Another important change is changes in toileting habits. For dogs, straining, squatting multiple times, peeing more frequently, having accident indoors. Owners often think it's a behavior. It's usually not. It's discomfort, infection, stones, or hormonal issues. For the cats, this is the big one. If the cat goes to litter tray repeatedly, or cries, or squats, but producing nothing, this can be an emergency. Male cats especially can become blocked, and that's life-threatening. If your cat visits tray more than 2-3 times without producing anything, call your vet immediately. When to act? So how do you know when those signals are watch and wait, and when those are grab the car keys now? Call your vet within 24 to 48 hours if behavior changes, eating or drinking changes, mobility changes, new mild vomiting or diarrhea, subtle but persistent pain signals. Call your vet now if struggling to breathe, collapsed, unable to stand, crying when touched, bloated abdomen, repeated vomiting, blood in urine or stools, cat using tray repeatedly without producing anything, sudden neurological signals like head tilt, wobbling, or seizures. How you should prepare before seeing the vet. To make your vet's life 300% easier and save you time and money, bring a timeline of symptoms, the video of anything unusual like mobility, breathing, or behavior, a list of food, treats, supplements, and meds, a urine sample if toileting is an issue, pet, not the photo of the pet itself, please. Here is something I want every pet owner to hear. You know your pet better than anyone. If something feels off, if your gut says that isn't right, you're probably correct. I'd rather see your pet earlier and say everything is fine than see them too late and have a fewer options to help. Trust your instinct. They are usually spot on. If you learned something today, or if you suddenly feel the urge to go and observe your pet like a wildlife documentary narrator, you're welcome. There are a dozen more secret signals out there. Those are the ones every single owner should know. If you're new here, hit that subscribe button so you don't miss the next episode. I'm Dr. Vet. I'm helping you to help your pet and occasionally making you paranoid in a productive way. See you next time.